This is the ultimate toenail fungus guide. I'm going to teach you exactly what to do to give you the best possible chance to take care of this thing and prevent those ugly fungal toenails from stopping you. All the science behind it. If it's thick and yellow, assume fungus. If this kind of stuff does not work at home, you could always get it biopsied, and that's your backup option. But if you want to try some stuff at home, this is pretty clearly fungus. There's lots of home cures available, but do they work? Let's take a peek. And why do we get it? Sometimes right here it's just bad genetics. Sometimes people are sweating too much, their socks are too wet and not clean enough, letting fungus survive. Sometimes it's old age and your body just can't fight it. Sometimes it's medical conditions like diabetes or smoking. Other times it's dry, itchy skin. This is athlete's foot fungus, where it just crawls up the foot and underneath the nail. So people are busy treating the toenail, but not treating their skin at the same time. Check our other guides to also take care of your foot fungus, because you got to take care of the nails and the foot. Most people don't take care of the foot. That's why this treatment fails. So we start with our foot fungus. Control your sweating. Get some new clean shoes. Throw out the old stuff. Use antifungal powders to stop the sweating in your shoe throughout a long work day. Get clean socks. Clean your shoes. Clean and shorten your nails so there's not crap all over them. And exercise. Be healthy. That makes your body recognize this stuff more and take care of it. These powders are cheap. They're under $10 and they work great to control sweating and at the same time kill fungus. These powders can prevent it. Then we're going to talk about using topical lotions to get rid of it 35% of the time. If you combine it with oral medications, that goes up to a 40 to 70% cure. And if you or your podiatrist can thin those thick nails, that allows for significantly better penetration, getting you up to that 70 to 90% cure zone. Most people only start doing the topical home remedies. That's why these never work. This is hard scientific data. Don't fall for the expensive crap being sold online. It is all a fraud with absolutely no scientific evidence behind it. Zero evidence. So all this stuff, it can work, but you got to do all the right stuff behind it. So trim your toenails, file them down to let better absorption happen with these powders, with these home remedies. And with foot fungus, it takes 30 days for a new layer of skin to grow. So from the bottom to the top. And toenails, they grow 1 millimeter per month. So you're looking at a minimum of 3 months just to start seeing the beginning show up. So that's how you can get these amazing results from before and after. You're going to be waiting realistically for some of these about 6+ months to start seeing these results. So you have to be patient and do all the right stuff. So number 1, vinegar soaks. 2/3 water, 1/3 vinegar, soak for 5 to 10 minutes. Very cheap and easy, but can irritate the skin. So use it at your own risk at home. But you're still in that 30% zone. You can also apply Vicks Vapor Rub at night. Not a lot of hard evidence, but the ingredients, the camphor, the menthol oil, or the menthol and eucalyptus oil, they are known to kill fungus. Very easy to use, but you're putting it on and it's not quite as potent as using some of the topical antifungals that are pretty cheap by prescription anyway. And then Listerine, same kind of thing. It's toxic to fungus but can irritate the skin, and it's in the 30% range. Very easy to use, but can be a hassle because you have to use it for a long time and not as potent as the topical prescription creams. Same thing with tea tree oil. Absolutely no evidence for any of this stuff. No one's done high-level studies. You apply it at night. Easy to use. A little bit pricier, but still overall cheap. But why not just get a prescription and have some hard evidence and have better efficacy? Just avoid the heavy chemicals like bleach. You're going to hurt your skin. We see this all the time with patients that come in. Be careful using all this stuff at home. Use the topical antifungal powders. These were great if you sweat a lot. Then, while this is a steroid, don't use a steroid on your toes. There are great creams and gels available for you that can work very well in the right conditions. That includes smoothing and trimming your nails, then applying them. 68% improvement. This is just one study, and they do penetrate deeper than these home remedies. But the bottom line is treatment is difficult. 30 to 55% chances in the studies of these home remedies that have been shown. But when you start getting an oral medication, a topical medication, plus having your nails professionally trimmed and smooth with application, you're going to get up in the 90% cure rates. But you might have to do it again in the future because the recurrence is 60% after 4 years, even if you do cure it. So remember, treat the actual foot fungus for 30 days and be patient with your toenail fungus. And you will get these results eventually. So, bottom line is, if you're having problems, it might not even be foot fungus. Get that toenail biopsied, get some prescription creams and a prescription oral medication, and get that stuff trimmed down, and you're going to get great results. Do not try any of this at home alone without supervision. This is presented by Michigan Foot Doctors. If you think our information helped you, give us a thumbs up and come visit the site for even more.